Good morning, everyone. Welcome to The Dark Truth About Chocolate, Flavanol Power for Heart Health. Today, we will discover why high quality dark chocolate and natural cocoa may support heart health when chosen correctly. This is a strict education material only and is not medical advice. Always consult your doctor before making any dietary changes. Welcome and why this matters. Today we explore how quality dark chocolate and cocoa can support heart health. Not all chocolates is created equal. The dark truth is that Flavanols rich minimal processed chocolate offers real benefits for blood vessels, blood pressure and cardiovascular function. This presentation uses simple language with everyday samples and the most up-to-date scientific evidence from 2023 to 2026 peer-reviewed studies, meta-analysis, and the landmark Cosmo trial. Educational material only. Learning objectives. By the end of this presentation, you will know the bioactive compounds in chocolate and how processing changes their level. You will compare flavanols content across cocoa powder, dark, milk, and white chocolate. You will understand mechanisms including the eNOS and the nitric oxide pathway, as well as the surrogate endpoints from clinical trials. You will evaluate long-term data from the Cosmo trial and recent meta-analysis. You will explore effects on metabolism, gut health, cognition, and bone health. Finally, you will discuss risks and optimal intake based on current guidelines. What are the good stuff in chocolate? Chocolate benefits come from naturally occurring bioactive compounds. Flavanols help blood vessels relax and function better. Procyanides are large antioxidant molecules that protect cells. Methylxanthines support blood flow and energy metabolism. Minerals such as magnesium and potassium support heart and muscle health. Higher non-fat cocoa solids, known as NFCS, mean more potential benefits. Natural cocoa powder is the richest source with 40.8 plus or minus 8.3 milligrams per gram of procyanidins. How processing affects bioactive compounds. Each step in chocolate production can reduce helpful compounds. Fermentation causes more than 80% loss of epicatechins and catechins. Roasting above 70% degrees Celsius degrades epicatechins and creates less active forms. Alkalinization, also called Dutch processing, causes the biggest loss and is dose dependent. Natural cocoa has 34.6 milligrams per gram total of flavanols. Lightly alkalized has 13.8, medium has 6.8, and heavily alkalized has 3.9 milligrams per gram. The good news is that stearic acid, the main saturated fat in cocoa butter, is neutral and does not raise LDL cholesterol. Comparing chocolate types. Which is best? Not all chocolates work the same. Here's a clear comparison. Natural cocoa powder has very high flavanols at 34.6 milligrams per gram and offers maximum benefits. Dark chocolate with 70% or more cocoa has high flavanol, ranging from 93.5 to 651 milligrams per 100 grams, and makes a great occasional treat. Milk chocolate has low flavanols and limited benefits. White chocolate has none, 0.0 milligrams, and provides no flavanol benefit. The key insight is to choose high percentage cacao with minimal processing. How do these compounds help the heart? Flavanols work mainly inside blood vessel walls. They activate the eNOS system. They increase oxide, nitric oxide, which is the body's natural artery relaxer. They improve blood flow, reduce stiffness, and support healthy blood pressure. They also provide mild antiplatelet effects that make blood less sticky and offer modest improvement in insulin sensitivity. Dark chocolate is full food matrix is approximately 8 times more effective for blood pressure lowering than plain cocoa drinks at the same Flavanol dose according to the 2025 systemic reviews. Short-term benefits. What randomized controlled trials show. Dozens of randomized controlled trials confirm quick effect. They show improved flow-mediated dilatation with an increase of 1.34% for chronic intake and 3.19% for acute intake. They lower diastolic blood pressure by 1.6 millimeters of mercury. They improve insulin resistance with a HOMA-IR change of minus 0.67. They provide modest lipid benefits with LDL decreasing approximately 0.7 millimoles per liter and HDL increased by 0.03 millimoles per liter. The Cochrane review of 35 randomized trials involving 1,884 patients found a blood pressure reduction of 1.76 millimeters of mercury in both systolic and diastolic reading. A 3 millimeter of mercury drop in systolic pressure meaningfully lowers cardiovascular mortality risk. Side effects are rare, occurring in about 1% of participants as mild gastrointestinal upset. Long-term benefit from population study. Large prospective studies involve hundreds of thousands of participants show that approximately 45 grams per week of dark chocolate is linked to an 11% lower risk of cardiovascular disease. The highest versus lowest intake categories show a 23% lower cardiovascular disease risk. The relationship is non-linear, with benefits peaking around 45 grams per week and declining above 100 grams per week. In the Women Health Initiative study of more than 84,000 women, 1 or 3 servings per week were associated with 7% lower all-cause mortality and 12% lower cardiovascular disease mortality. The landmark COSMO trial primary results. The cocoa supplemental and multivitamin outcome study is the largest randomized controlled trial in this area. It included 21,442 older U.S. adults who received 500 milligrams per day of cocoa flavanols, including 80 milligrams of epicatechins or a placebo for a median of 3.6 years. In the intervention to treat analysis, total cardiovascular events were 10% lower with a hazard ratio of 0.9, which was not statistically significant. Cardiovascular death was 27% lower with a hazard ratio of 0.73, which was statistically significant. In the per-protocol analysis of regular users, there were 15% fewer total cardiovascular events. Cosmos Advanced and Auxiliary Findings 23 to 26. Newer analysis strengthened the signal. The win ratio analysis confirms benefit with the alpha value p-value of 0.037. When adjusted for background diet and adherence, the hazard ratio for total cardiovascular events improved to 0.65 and for cardiovascular mortality to 0.44. The inflammation marker, high sensitivity CRP, showed an 8.4% reduction per year. Incident hypertension was 24% lower in participants with normal baseline blood pressure, below 120 millimeters of mercury systolic. There was no effect on new diabetes cases. There was a possible early benefit on age-related macular degeneration risk in the first 2 years, but no overall difference after 3.6 years. Metabolic and diabetes effect. Latest evidence. Recent large studies show that 5 or more servings per week of dark chocolate are associated with a 21% lower risk for type 2 diabetes, according to Liu and colleagues in the BMJ 2024. This is a linear effect with a 3% risk reduction per serving per week. Milk chocolate shows no diabetes benefit and is linked to a long-term weight gain. In people with diabetes, there are modest improvement in fasting glucose and LDL cholesterol. However, the Cosmos trial itself found no reduction in new diabetes cases with a hazard ratio of 1.04. Gut microbiome effect, prebiotic potential. Cocoa Flavanols can act as prebiotics. They increase beneficial bacteria such as Bifidobacterium and Lactobacillus while reducing some Clostridium species. They boost production of short-chain fatty acids including acetate and butyrate. These changes improve gut barrier function and reduce inflammation. Recent findings indicate the evidence is promising but mixed. Benefits appear strongest with moderate and consistent intake of flavanols-rich cocoa. Other health areas: cognition, bones, cancer. For brain health, there are theoretically benefits through antioxidant effect, but the Cosmos trial showed no consistent cognitive improvement in older adults. For bone health, the Cosmo randomized control trial found no reduction in fracture risk with an adjusted hazard ratio of 1.03. For cancer and aging, there is no significant reduction in cancer risk and no effects on epigenetic aging clocks. The current evidence for this area has low to moderate credibility, and more research is needed. Potential Potential downsides and risks. Heavy metals such as cadmium and lead are present in some chocolates. Most products are safe for typical adult moderate intake. The risk is mainly for young children with very high daily intake. Adults show no adverse risk at 1 ounce per day. The vast majority of bars fall well below FDA interim reference levels. Other concerns include calories and sugar, so choose dark chocolate with minimal added sugar. For migraines, the evidence is limited. The association may reflect craving rather than a true trigger. Organic products sometimes show higher heavy metal levels, but overall risk remains low under typical use. Special population evidence based advice in pregnancy: moderate intake of 30 grams per day of 70% cocoa may help blood pressure, but excess should be avoided in the third trimester. For children, choose lower risk origins and keep amounts moderate due to heavy metal concerns. For older adults, moderate flavanol rich chocolate may support heart health, with excellent safety demonstrated over 3.6 years in the Cosmos trial. For people with diabetes, it can modestly help glucose and LDL cholesterol when included as part of the balanced diet. Optimal intake and guidelines. Evidence-based recommendations suggest 1 to 3 servings per week or up to approximately 45 grams per week of 70% or higher dark chocolate. The Academy of Nutrition and Dietitians recommend 400 to 600 milligrams per day of flavin 3 oils from nutrient-dense foods, including cocoa, tea, apples, and berries. The Cosmos dose of 500 milligrams per day was safe over the long term and showed clear signals of benefit. Moderation is essential, and the sweet spot is around 45 grams per week. Smart choices and counseling tips to get the most benefit. Prefer natural, non-alkalized cocoa powder or 70% or higher dark chocolate. Check product origins for lower heavy metal content. Enjoy chocolate with a healthy plant-rich diet to avoid excess calories and sugar. Remember that evidence quality is rated low to moderate by grade criteria. Chocolate is not a substitute for proven lifestyle measurements and medical care. No major cardiology societies currently prescribe chocolate as a primary prevention strategy. Key take home messages. Here are the key messages to remember. Quality and moderation matters. High flavanol, minimal processed dark chocolate best preserves the benefits. The strongest evidence support better blood vessel function, modest blood pressure lowering, and reduce cardiovascular death. Dark chocolate, but not milk chocolate, is linked to a 21% lower diabetes risk in recent large studies. Risks including heavy metal and calories are manageable with smart choices and moderate intake. Chocolate can be enjoyable, part of heart healthy living, but it's not a magic pill. This presentation draws from peer-reviewed sources including the following: for bioactive compounds and processing,